Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Little soggy, but okay.
Our first snowfall here in Chicago, but I'm excited to have Dr. Murphy here, who is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing a viewer submitted question, the latest headlines, and our lone US COVID statistic through today, November 21st. We invite you to submit any questions or suggested topics down in the comments or at any of our social media linked in the description. Starting with our abbreviated COVID statistic, average COVID deaths per day in the last reported week were 63 daily. In the same week in 2023, we saw 178 daily COVID deaths. Your reactions to those numbers and the state of COVID in the country, Dr. Murphy?
Well, it hasn't changed for the last couple of weeks, and we're basically just waiting for the next bump up in cases with the flu that is actually already starting, but really picks up in December and January. So, we're at the nadir of the process right now, the infection process right now from the summer bump that we had. And so this is about as low as it's going to go, but it's a lot lower than last year. So that's a good sign too.
Absolutely a good sign. And before we move on from COVID today, there was a very interesting report published in a virology journal regarding COVID in animals at zoos. High numbers, higher than expected. Can you tell us about that data?
Yeah, it's animals at a zoo in Brazil, in Belo Horizonte, from 21 to 23. They decided to test all the animals, and they did. And 1/5, 19.1% of the animals tested positive for SARS-CoV-2, for COVID. And they found it in many different types of samples, and there were a variety of different variants. It wasn't just like one variant. So it wasn't like the population of, it was all spreading between the animals in the zoo. It most likely was involved humans that were at the zoo as well, either workers or visitors, who knows? But I think we have to start thinking, or we already are thinking that, the whole COVID infection involves animals as well as humans. So, there's a giant pool of virus out there in a variety of different places, populations and animals.
Absolutely, in places you wouldn't necessarily think of off the top of your head. But coming to our viewer submitted question this week, our viewer asks, can you let us know if seniors over 65 or anyone generally can ask their primary care physician to prescribe a course of Paxlovid to have in hand ready? So they don't have COVID-19 yet, but just in case.
Paxlovid, unfortunately, is very expensive. And it does expire after a certain period of time. You have to look at the box, typically 2 years, but it'll depend on which one you have. And you shouldn't just keep a box of it around. It's very easy to get in the United States and in Europe and many other countries. But in some countries, it's not available at all. So I would think that it would be a doctor-physician decision if a person at high risk for getting sick from COVID was going to an area in the world where the drug is not available. You're traveling to East Africa on a safari, or you're going for business in many places in Latin America. Some places have it, but many places don't. So anyhow, in that particular scenario, that's a personal decision. It doesn't really, it's in kind of a gray zone. I mean, if you don't use it and you don't use it over the next 2 years, I mean, you just threw quite a bit of money down the drain. So but if you're a very at-risk person and you're traveling to one of those places, it might be good to have it. I can tell you what happened to me earlier this year. I was in France and I got COVID. And yes, the pharmacy had it. And yes, they were willing to sell it to me, but it was over €1,000 for the 5-day treatment. So that's like about at the time $1,100. So it was an expensive treatment course, but I took it. And it's very complicated to come back and then submit all the paperwork and stuff, and it's in French, and it was very challenging. Let's put it that way. But anyway, so one thing to be sure about: it's not approved for pre-exposure prophylaxis. In other words, you don't take it to prevent COVID. And if you are exposed to somebody, it's not approved for that either. Those trials have been done and it didn't work. You have to have COVID is the actual official approval. So this scenario that's described here, say it's a person going to a place where it's unlikely to find it. I mean, and they're at high risk. I think that's a personal decision with the physician. So I think I would just leave it at that. I get the question a lot, actually.
Yeah. So if it's someone just here in the United States, you wouldn't be able to get it to have it on hand. You would have to have your
No,
infection and
no,
then go get it.
you wouldn't need it in the United States or Europe. You really wouldn't need it because you
Mhm.
can very easily get it.
Now, moving on to one of our big stories over the past few months, there have been some updates about the H5N1 avian flu. First, there is another human case in a child in California, as well as a case in Oregon, and an update on that Canadian case we were talking about. Can you give us those updates?
Yeah, a young child from Alameda County, just across from San Francisco, has a possible case of avian flu right now. That child had not had any exposure to animals, to either birds or cows. The child tested positive, and there's further testing going on. The Oregon case was a poultry worker, so that was no big surprise. The Canadian case is a teenager who got very sick and was in the ICU. That has a mutation that can make it more transmissible, and that person had no contact with animals, and but all the people around that person, the family and close friends, anyone that person had been in contact with, are testing negative. So it's just an oddball case, but these kind of cases we had one here, now we have two. Next week, are we going to have 4 or 8 or whatever? Is it going to keep increasing, or is it going to stay pretty low? We don't know, but I mean, this is one of the big fears about avian flu, because as shown by this teenager, that kid's in the ICU. That kid is very sick. So we'll see. We'll see what happens with this. Got to be monitored very closely. There is a vaccine developed to prevent this. It will most likely be released in poultry workers and high-risk people, if this continues like this.
Mhm. And you noted in a previous episode that British Columbia and Canada in general has a very, very strong surveillance system in terms of flu surveillance, specifically in health things. And
Yeah,
that is how this case in the child was found, was through that routine surveillance. And that's not necessarily something we have here in the United States.
no, not really. It's very spotty here. There is really no nationwide public health program in the United States like other countries have. I mean, it's very hit or miss.
Mhm.
We have
Well, speaking of some,
we have very good tertiary care. I mean, you can have the most elaborate treatments for your disease that more than almost any other country. I mean, any other high income countries. Many of that stuff, much of that stuff is available, but public health is up to the state. Some states do it good and some states do it badly.
Mhm. Well, one thing that luckily was found and reported is that the United States and the state of California reported, the first case of clade 1B Mpox in the United States. Can you tell us where it was and how did it get here?
Yeah, this was a person who had been recently traveled in East Africa. So it's no big surprise that this person got it, but they identified it, treated it. It's a more deadly version of the virus than the clade 2, which was the one that was circulating predominantly worldwide in men who have sex with men. So anyway, the person's been identified and is doing okay. Since late September of this year, more than 3,100 Mpox cases have been confirmed globally, most of them in the Democratic Republic of the Congo, but many other African countries and many European countries as well. So it's still a big public health hazard. And in Democratic Republic of Congo, where it has the most impact, they still think that they require 3 million doses of vaccine to vaccinate the highest risk people to dampen this thing down.
A very big project and an ongoing one. And our next topic is one that's come up a little bit more and more recently. A few weeks ago, we talked about E. coli linked to McDonald's onions. Now I understand that there has been another E. coli outbreak linked with certain carrots. Can you tell us about it and how many people are sick?
Yeah, so this new E. coli outbreak occurred in organic carrots, and 39 individuals have gotten ill, and 15 have been hospitalized. So these carrots ended up being sold to many different stores and distributors. They have names like Bunny Love and store brands from Kroger, Publix, Target, Trader Joe's, Walmart, Wegmans, and Whole Foods, basically everybody. And it's, like I said, 18 states, does not include Illinois, Indiana, or Wisconsin, but does include Michigan, one case there. And it just shows you, if you get a nasty pathogen like this, how quickly it can spread in multiple states. This is just the food distribution system that exists in every country. So it can get out there very, very quickly. Look what happened with the boar's head meat and the listeria. And, it spread. That's how it spreads. And
Mhm.
this is a nasty infection.
Yeah.
Yeah.
A reminder to always wash your fruit and vegetables, even if the package says they've already been rinsed.
Right.
Not worth the chance.
Yep.
Now, something that we talk about a lot
Mhm.
and that has been surging in case numbers globally and increasing here in the United States is measles. Can you tell us about the state of measles globally and here in the US?
Well, this is very important because if the vaccine acceptance rates continue to drop, this is just going to become incredibly common. It's going to come back. In 2000, it was almost eliminated in the United States. And then it bounced back as the vaccine rate dropped down. Got re-imported to the United States from other areas that don't have high vaccine uptake. In 2023, an estimated 10.4 million people globally, mostly kids, were infected with measles. There was a 20% increase over the year before. Roughly 107,000 deaths. Measles can be lethal, can cause encephalitis. It's highly preventable with one or better with 2 shots of the vaccine. Vaccine has been around for decades. That rate has gone down. So as of November 7th of this year, there were 277 cases in the United States from 32 jurisdictions around the country. And that's That's just the ones that are being reported. So it's probably a little bit higher than that. Mostly it's kids under 5. 85% of all those kids were unvaccinated. So that's the driver of this thing. 40% of them, of the 277, required hospitalization. So, that's how sick people can get from measles. So this is something we really have to watch, especially if the vaccine uptake drops even more. We're just going to see more and more and more of this because this is so
Absolutely.
highly contagious.
And with that high level of contagion, it can also be dangerous for healthcare workers or other people in, say, emergency rooms if people
Right.
aren't sure what they have.
Yep.
If you ever suspect that you or a loved one has measles, please call your doctor, let
Right.
them know. They will give you instructions to
Give them
avoid.
instructions on how to of what to do.
Mhm,
Just show up at the
absolutely.
clinic or at the emergency room.
Mhm. Now, our final story for today is also not a super positive one because three more countries are reporting polio cases this week. Can you tell us what countries they are and where we stand with polio?
Yeah, so polio was almost eradicated about 10 years ago. There was this huge push by the Gates Foundation and the Rotary International. They were just this close and it didn't work. You can't give up with polio. I mean, polio is an eradicable disease potentially. So these 12 cases were in Pakistan, Chad, and Nigeria. Nigeria had 7 cases. And in all of 2023, there were 536 confirmed cases, including wild type and the vaccine-induced ones. And as of June in 2024, there's already been 672 confirmed vaccine-derived cases in the world. So we got to just keep up with this because ultimately we can get this. This is another really debilitating disease that you don't want to ever get. But it's in these low and middle income countries that have a lot of challenges in the healthcare system. But we just have to be vigilant and continue with the vaccination programs until this thing is really stamped out.
Mhm. And I know that vaccine derived doesn't mean that you received measles from that vaccination, but can you explain just a little bit of what that
Yep.
vaccine derived name really means?
Well, the vaccine has an attenuated, weakened virus in it. All right. That ends up, in the environment ultimately, and that's where the exposure comes. It's not person to person or anything like that. And so the vaccine derived is typically a weaker form of polio, and affects typically unvaccinated people and people with weak immune systems. So the wild type is the one that the natural one that's just out there. So of course we want to get rid of all of it, but we have to continue with the vaccines now until we can get these numbers down.
Absolutely. And on that note, I'd like to thank you, Dr. Murphy, for your time and expertise this morning, answering our viewer submitted question, breaking down the headlines, and the latest data. It's much appreciated.
Well, great to see you again and have a great weekend.
Thank you very much. And thank you all for joining us for another episode of the Ask Dr. Murphy series. As always, if you have any questions or suggested topics, please leave them down below in the comments or at any of our social media linked in the description. We'll see you next week. Have a lovely weekend.